Well, hi to my YouTube subscribers. Well, this video isn't about Thai visa issues. It's about a surgery that I'm going to have tomorrow morning at Bangkok Hospital Phuket. So if you're a medical geek or you just want to learn a little more about getting medical care in Thailand, stay tuned. Otherwise, go ahead and skip this video. So I've had increasing pain in my right hand for the past 2 years, and recently it's become more acute. So the sharpest pain is right here, right at the edge of my right hand. It actually feels as if there's a nail sticking in the spot. At times it flares up and becomes very painful. I also have skin sensitivity in this area, so when I touch it right now, it feels quite painful to the touch. And my pinky finger feels as if it's compressed. It feels quite painful. Now, I had trigger finger in my middle and ring fingers. Trigger finger is when you close the fingers and they just don't want to open up. Now, since I'm fully covered in the US, I returned there to fix the problem. So first I had nerve testing to determine whether there was damage to the ulnar nerve, which can cause problems like this. These tests were entirely negative, and based on these negative nerve findings, my hand surgeon in New York felt that the pain was probably referred pain caused by the trigger finger syndrome. In particular, in trigger finger, the tendon controlling finger movement becomes inflamed, and it gets caught at the opening to the sheath through which the tendon passes. Now, the place where this happens is known as the A1 pulley, and there's an A1 pulley at the base of each finger. So while the pain I had was at the edge of my hand, it was reasonable to think that this might be the result of an inflamed A1 pulley at the pinky finger. So the surgeon did a release of the pinky, ring, and middle fingers, which fixed the trigger finger. And I documented this in a video, my trigger finger release surgery, and I'll put a link to that in the description. Now, this is a relatively easy surgery with small incisions, and I recovered quickly. My recovery was full, except that my middle finger is sometimes mildly painful and doesn't straighten completely. The surgeon assured me that this would correct itself in time. I was told to regularly bend the finger backwards to stretch the tendons. But unfortunately, the surgery had no effect on the pain at the edge of my hand. The doctor in New York suggested that I give it more time to heal on its own, so I returned to Thailand. Now, in Thailand, the problem grew worse. I saw a hand surgeon at Bangkok Hospital in Phuket, and she ordered a new set of neurological tests. These tests showed significant abnormalities in both the ulnar and, to a lesser extent, the median nerve of my right hand and arm. This result directly contradicted the result of my neurological test in New York, but the test in Thailand was a much more thorough test than I had in the US, and the report that was generated was significantly more detailed and quantitative. I believe that the result of the test done in Thailand is correct, and it would completely account for my symptoms. I don't know why the test I took in the US was negative, and I'm not particularly happy about it. Now, based on the neurological testing, an MRI, and physical examination, the surgeon determined that I had impingement of both the ulnar and the median nerves at the elbow, and impingement of the ulnar nerve at what's known as Guyon's Canal. Now, Guyon's Canal is a structure near the wrist through which the ulnar nerve passes. This nerve innervates the pinky and the half of the ring finger that's nearest to the pinky. This is exactly where I've been having pain. The floor and the roof of the canal are formed by distinct sets of tendons and ligaments. Those interested in more details about this procedure should have a look at the link that I put in the description. And this is a beautifully done video with great explanations by the surgeon. Much better than I could do. So what's clear from this video of the Guyon's Canal procedure is that the procedure involves much more than just opening up this canal. Both the sensory and the motor branches of the ulnar nerve must be very carefully freed from their surrounding fascia, that is the tissue that clings to these nerves, and any other structures, and there are quite a few, that might impinge on the nerve. Now, my surgeon also recommended doing a nerve decompression at the elbow, where it appears that there is some impingement of both the ulnar and the median nerve. Now, this is not the procedure that's called a nerve transposition. That's a much bigger procedure where the nerve is actually relocated to the side of the elbow. This is a much simpler procedure where the surgeon just makes a small incision at the elbow just to free the nerve from surrounding structures that might be impinging on it. Now, I'll be in a hard cast for a week following the surgery, and then a soft cast for some additional time. So the surgery is done with a local nerve block from the shoulder down, and that's similar to the nerve block that I had when I did rotator cuff surgery. So the block lasts from 6 to 10 hours. It's great because right after the surgery, you don't have to worry about pain for a while. And I'll be given painkillers for when the block wears off that night. So I'm not allowed to eat anything after midnight tonight, and I can have a very small amount of water before 4 a.m., but nothing after that. So I'm staying at the Hotel Buanda, which is very comfortable, and it's less than a 5-minute walk from the hospital. So I'll remain at the hospital for a few hours after the surgery, and then I can just walk back to the hotel. Now, the cost of the surgery is 86,000 baht, or about $2,500, and that includes all the pre-op testing. Now, that's a fraction of what this surgery would cost in the U.S. without health insurance. In my case, I felt it was worth this expense in order to avoid a round trip to the U.S. and experiencing winter in New York. I think it'll be a lot nicer recovering here in Phuket. I also have a lot of confidence in the hand surgeon here. So am I concerned about doing surgery in Thailand? Well, my surgeon at Bangkok Hospital is very well qualified and experienced. She did a great job with my diagnosis, and she communicates very well. My experience so far at Bangkok Hospital Phuket has been terrific. The level of individual attention far outstrips anything you'd find in the States. And I've had 5 major orthopedic surgeries in the U.S., so I feel like I can compare. And the care in the U.S. is fine, but you really do get a lot more individual attention at a private hospital in Thailand. Now, people visiting Thailand should be aware that the model of care in Thailand is very different from that in the U.S. In the U.S., I visit my doctor at a large medical group. In Thailand, you go to the hospital to see your doctor. You don't have doctors going back and forth between their medical practices and the hospital. It's all in one place, generally. There are some doctors who operate from clinics or individual practices, but I've had medical care before in Thailand, and I've always gotten it at the hospitals. Now, in Thailand, there are private hospitals and government hospitals. Now, all Thais are entitled to free medical and dental care at government hospitals. Now, some procedures like dental implants aren't covered. Thais who can afford it will often go to private hospitals, as these hospitals are less crowded and there's a belief that the care is better. Now, in the U.S., if your doctor refers you to a specialist or refers you for specialized testing, you might wait weeks for an appointment or even months for a top specialist. In Thailand, I haven't had this experience. You generally get an appointment right away, or you might be told to come back to the hospital on a particular day when your doctor is going to be there. So if you're not given a specific appointment, or if you just show up at the hospital, you'll just wait your turn to see the doctor. If your doctor wants you to go for tests or imaging, you'll generally get that right away. And if you're referred to a specialist, there's a good chance you'll see that specialist that day, or on the first day that that specialist has hours at the hospital. I much prefer the Thai system to the US system. In the US, there seems no immediacy in diagnosis and treatment unless you're actually having an emergency. Now, as far as medications, few medications require prescriptions. You can just go to a pharmacy and buy what you need, except, of course, for opiates. I think there's an assumption here that people are not going to abuse their blood pressure medication. So it's probably evident that I'm a fan of the Thai way of doing medicine. And for me, this surgery will be a big test. If this works well, I'll probably get Thai medical insurance and just use my US Medicare as a backup. Now, if you have recommendations for Thai medical insurance, please put them in the comments. I can definitely use the information. And I'll probably be making a video on Thai medical insurance sometime in the near future. And, of course, I'll be reporting back on my surgery. So next time you see me, I'll probably be in a cast. So see you soon.